Hi, thanks for having me. So today I'll be talking about disparities in depressive symptoms among people with HIV and how they might diminish with older age, and I'm at poster 15. So the primary aim of this study was to examine differences in domain-specific depressive symptoms by HIV status and age in a large US sample. As we know, depression is up to twofold as prevalent in people with HIV as compared to the general population, but this relationship is a bit unclear when we take a look at age. And so we took a look at 3,848 participants, about 80% were people with HIV, mean age of 48 years old, about half white, and 80% male. And then for our primary statistical analyses, we conducted multiple linear regressions, looking at HIV status, age, and their interaction as the primary predictors. We also covariated for race, sex, lifetime history of substance use disorder, and neurocognitive impairment. So for our results, in unadjusted models, we did find a significant HIV by age interaction on somatic symptoms of depression, but this interaction effect became non-significant in the adjusted model and was removed. And we did find statistically significant findings in adjusted models looking at different types of depressive subscales. Sorry, I neglected to point these out earlier, but we looked at 3 different types of depressive subscales that were of primary interest, so somatic, affective, and cognitive. And then we also looked at apathy and anhedonia subscales, which overlapped with somatic and affective symptoms. So going back here, what we did find in adjusted models as being pretty notable were the fact that if you had HIV, a lifetime substance use disorder, neurocognitive impairment, and were a white versus black race, you did find elevations in all 5 BDI subscales. Sex also made a difference. So if you were female, you had higher elevations in affective, somatic, anhedonia, and apathy symptoms. And interestingly, with older age, that was related to fewer affective, cognitive, and apathy symptoms, but not to fewer somatic symptoms and anhedonia. So what we find is that people with HIV do disproportionately have a higher rate of depression. This tends to decrease with older age, but not for specific symptoms such as somatic and anhedonia symptoms. So for future interventions, this might want to be the target to look at specific symptoms of depression. Thank you.